Position the patient supine. If patient condition allows, elevate the head of the bed to 30 degrees. On the affected side, place the patient's arm over the head, as demonstrated here. Apply supplemental oxygen, pulse oximeter, cardiac monitor, and BP monitor. Consider medication for sedation and analgesia. The usual insertion site is at the 4th or 5th intercostal space between the mid and anterior axillary lines. Care should be taken to avoid insertion through breast tissue. If necessary, retract breast tissue with tape. Prepare necessary equipment: chest tube insertion tray or procedure tray with curved forceps, scalpel, prep solution, local anesthetic, chest tube, suture, dressing, and Pleurovac. Don mask, gown, and gloves. Using povidone, prep a large area. Include the region from sternum to posterior axillary line and clavicle down to inferior rib margin. Remember to prep the axilla. Prep for a total of 3 times. Drape the entire area. Draw up 20 cc's of lidocaine. Re-landmark and infiltrate the skin using a 25 gauge 1.5 inch needle. Inject over the superior border of the rib to avoid the neurovascular bundle. Anesthetize the periosteum. Aspirate while advancing needle through subcutaneous tissue. Return of air indicates the parietal pleura has been reached. Inject a bolus of local anesthetic to freeze the pleura. Re-landmark insertion site. Using a scalpel, make a 2 to 4 centimeter incision following the orientation of the ribs. Using curved forceps, bluntly dissect through the subcutaneous tissue just over the superior border of the rib. Puncture the parietal pleura with the tip of the forceps. This should release a rush of air or fluid. While still within the pleural cavity, spread the forceps widely, then remove. Place gloved finger into the incision to verify that the pleura has been entered and to clear any adhesions, clots, etc. The finger should sweep completely around the incision. Using the curved forceps, clamp the end of the chest tube with the drainage holes. Place the tip of the tube into the pleural space. If possible, you may use a fingertip to guide the tube insertion. Release the clamp and advance the tube superiorly and posteriorly to the desired depth. Ensure all drainage holes are within the chest cavity. Look for fogging of the chest tube with expiration and listen for air movement. To suture the tube to the skin, place the anchor suture across the incision and tie a knot. Next, wrap the suture around the chest tube several times and tie securely. Apply an occlusive dressing such as adaptic and drain sponges. Secure with Mefix. Tape the tube to the chest. A FlexiTrack may be used. Connect the chest tube to an underwater seal apparatus, the Pleurovac. Apply waterproof tape to the connection. Ask the patient to cough and observe for bubbles in the Pleurovac. Set the suction to -20 centimeters of water. You should observe the orange float rising once the wall suction is applied. Bubbles will appear in the air leak meter if there is an air leak or if patient coughs. Obtain portable chest X-ray to assess for tube position and degree of lung expansion. Monitor Pleurovac for fluid drainage or air leak. Continue to monitor patient's vital signs.